it's quite a sort of controversial area in that, well, not everybody likes the idea of animals being used for scientific research. My own view is that in a disease like dementia, there is quite a good justification for the careful and conscientious use of experimental animals for research purposes. I have to say that the majority are rodents, rats and mice, that they have taught us some things about the pathology, how the disease molecules get together. I'm not sure they have helped us particularly in getting any closer to a cure. And so, yeah, animal models are an area I've worked in for 20 years. I'm more inclined to look at large species, what are called domestic species. I'm thinking of sheep and pigs, which have a bigger brain, more like the human brain. And maybe we'll learn a little bit more from those larger species. Of course, the mice and rats are still necessary for the toxicity screening and mechanistic experiments. And of course, alongside those, there are test tube and Petri dish experiments where you don't need any animals at all. And that those what are called in vitro, in glass experiments are still very important as well. They have bigger brains. Critically, they have a lot of what's called white matter. If you've ever seen a picture of a human brain, it has a gray matter and a white matter demarcation, and a lot of the vascular disease happens in the white matter. So as you can imagine, I'm particularly interested in white matter damage and how it contributes to dementia. And I feel that these large-brained animals that many of us are eating as food species can teach us a lot about how white matter does suffer damage following vascular disease, and maybe may sort of break up the logjam in understanding molecular mechanisms and possibly providing more targets for therapy.